Fighting the War on Drugs. A presentation by Paul Brackey. Author, publisher American Leadership Books. Author of 9 books on social, political, and criminal justice issues. Not only are we losing the war on drugs, but this war is taking money from budgets that would be better spent elsewhere. Some incentives in the system keep this costly war going. An example is the officer who makes drug arrests and gets overtime for doing the paperwork for each arrest. Since the officer can make more arrests for drug cases than an investigator who solves homicides, he gets more praise and makes more money doing this, and is more likely to be promoted. The drug war is also very expensive due to the cost of imprisoning those convicted. Incarceration costs $15,000 to $60,000 per individual per year. Additional costs are incurred by arresting and processing an offender from arrest to conviction. The war on drugs has not only failed to stop drug use, but it has failed to stop the spread of international gangs involved in drug sales. Instead, the underground nature of the drug industry has led to a large criminal element involved in producing, distributing, and selling drugs. This criminal element has included gangs in the US, Mexico, and other countries, who provide drugs for US customers. Dealing with this criminal element has added costs of arresting dealers and processing them through the courts and prisons. Much of this criminal activity comes from Mexican drug cartels, which engage in extremely brutal actions to spread their profitable business enterprise through cities around the U.S. As long as there has been high demand for drugs, the sellers have found multiple channels for bringing drugs to the end user. Given the large demand and multiple channels, the prohibition approach has not been effective, while costing very large amounts of money. There have been high costs for trying to stop drugs, investigating, making arrests, and processing the cases. The drug war has also raised the cost of drugs to the end users, many of whom commit crimes to feed their habit. Educating kids and young adults against using drugs has not fixed the problem either. Education doesn't work because of peer pressure to use drugs, adolescent rebelliousness, and the way drugs make users feel very good at first. As a result, after using a few times, before they realize it, users become addicted, so now education doesn't work at all, though intervention and therapy works in some cases. The medical professional has contributed to this problem by overprescribing opioids for pain. Everyone agrees this opioid addiction epidemic has reached crisis proportions in both urban and rural areas. Doctors need to become part of the solution rather than the problem by not overprescribing opioids for pain and looking for other types of treatments for this problem. More treatment centers must be opened to treat addicts rather than merely incarcerating them. Another barrier to combating the war on drugs is that the American public has developed an increasingly permissive attitude toward marijuana. It will be hard to combat this permissive attitude, even if the federal government clamps down. Medical marijuana represents a first step in the direction of approving recreational marijuana in many states. Since marijuana can be a doorway to other drugs, especially if the restrictions on using it come down, the experience of states approving its use should be carefully monitored. This monitoring may show increased problems resulting from legalization. Special consideration should be given to studying the effects of marijuana use by underage adolescents, since their brain development might be adversely affected by its use. If further research shows this adverse effect, younger users should be prevented from buying and using marijuana. Concentrate efforts and resources on addictive opioids rather than other drugs. This focus will have the greatest effect on overcoming the opioid crisis. Secondarily, target other addictive drugs that contribute significantly to overdose deaths, such as cocaine, amphetamines, and benzodiazepines. Concentrate more efforts and resources on drug treatment to reduce demand, since it has been very difficult to reduce the supply of drugs into the country. Reducing demand will lead to reducing the amount of drugs entering the country. The President or Congress need to institute a crackdown on the production and import of addictive drugs by Chinese chemical manufacturers. These manufacturers are especially responsible for the production of fentanyl, which is replacing heroin as a source of most overdoses. China also produces carfentanil, an elephant tranquilizer, which is 100 times more potent than fentanyl, since 5 grams can kill 250,000 people. Establish mandatory minimum sentences as a penalty for distributing certain opioids, with the length of sentence based on the amount of the drug seized. Perhaps the longer sentences can help to gain information on, arrest, and convict higher-ups in the chain of suppliers, although the biggest dealers may continue to escape these penalties by relying on lower-level dealers and mules. To cut down on the supply of drugs, we have to be more successful at interdiction at all ports of entry and along our borders. More trained sniffer dogs and new technology can help to do more effective screenings at our border. Any methods of interdiction should be supplemented by screening all chemical shipments from China, since China is a main source of the addicting drugs. Set up a tip line for information that leads to the arrest of drug traffickers. This tip line can be set up so that callers can protect their anonymity. Callers should receive substantial rewards by providing information that leads to the arrest of high-level drug dealers. The rewards to tipsters can be tiered, so that those who target higher-level drug dealers can earn more. An encrypted system can be set up so that tipsters can both remain anonymous and claim a reward. Actively investigate and seek assistance from medical associations to help track down doctors who overprescribe drugs that may end up on the black market. Encourage these associations to institute penalties, including doctors losing their AMA certification or membership if found guilty of illegal drug sales or overprescribing drugs. Unfortunately, once addicted, individuals can remain stuck, since few addicts can afford the kind of treatment center that has cured high-profile celebrities, such as Rush Limbaugh. Even many middle and upper-income addicts don't have the necessary funds to join these expensive kick the addiction programs. Thus, addiction affects all classes of society, not just those in the inner cities. Since addicts have trouble getting over their addiction, we need treatment plans rather than punishment for them. From a cost-savings standpoint, drug treatment reduces expenditures. These big financial savings to society result from a reduction of a variety of costs due to drugs, which include costs of violent and property crimes by drug addicts, prison expenses, court costs, health and social costs, including emergency room visits, child abuse and neglect, child support costs, foster care and welfare costs, work-related costs. Extensive research has shown that treatment for abusers in the criminal justice system and for those living outside it has proven effective. The National Institute of Drug Abuse has found that those who participate in community-based drug abuse treatment programs commit fewer crimes than those who do not participate. Sentencing policies should be changed to allow some nonviolent drug offenders to get out of prison early, if they complete an intensive treatment program. Special drug courts should be instituted for nonviolent offenders, since this approach has worked around the country. Such a program offers addicts an opportunity to participate in a treatment program, along with help in finding work, if they are successful in completing the program. The quarter of offenders who graduate from these drug courts have greatly reduced rates of recidivism and re-arrest. These programs cost our cities significantly less than standard prison sentences. Instead of sentencing nonviolent small-quantity drug offenders to prison, judges should find less restrictive penalties, such as time served, coupled with treatment and probation or community service. Drug abuse treatment programs should be incorporated into a variety of criminal justice settings. These programs might include treatment as a condition of probation and drug courts that combine judicial monitoring and sanctions with treatment in prison. Later the ex-con might participate in community-based treatment, after being discharged or while still being supervised under parole or probation. Access to proven treatment and recovery efforts should be expanded, primarily to reduce the demand and help users overcoming their addiction. Since there are many treatment centers and plans, some more effective than others, research should be conducted to determine the best treatment and recovery approaches. More funds should be provided for research into better addiction treatments. Since present treatments are only moderately effective and relapse occurs frequently, more effective treatments are sorely needed. The opioid epidemic is as critical as the HIV/AIDS epidemic was, but addiction research receives only a fraction of the funds that AIDS research did. Opioid users aren't able to mount as effective a lobbying effort as homosexuals have done, because they are debilitated by their addiction. The families of opioid users haven't been able to lobby for them either, since addicts are often estranged from their families. Thus, the federal government has to provide assistance with researching treatment options. Once the best strategies are determined, they should be carried out on a mandatory basis on addicts in prisons and jails, even if that requires segregated facilities for them. Such treatments should be mandatory, since otherwise addicts will easily relapse once released and revert back to a life of crime to feed their habit. Different treatment plans could be tried out on prison populations in order to determine which are the most effective. Sentences could be reduced for those who come clean by both stopping use and identifying their suppliers. Extend cost-effective programs that work to the public at large in less restrictive settings. As a last resort, provide drug addicts with free methadone and monitor them to be sure they don't return to using hard drugs. This approach has worked in Portugal. Compared to 312 deaths per million drug-related deaths in the U.S., Portugal has only 6 deaths per million. Though this approach doesn't fully solve the drug problem, it does reduce its horrific consequences. The cost of such treatment is a tiny fraction of the cost of what we spend on the war on drugs. Previous books and chapters on the opioid crisis in the U.S. Dealing with crime by illegal immigrants and the opioid crisis. Chapters in Crime in America. Uncertain Justice. For more information, American Leadership Books. Little Rock, Arkansas. www.americanleadershipbooks.com. Info@americanleadershipbooks.com.